Itching in the private parts can be a very distressing symptom, and quite often they come with this complaint along with some other illness. And every gynecologist practically writes at least one prescription per day. I would like to give a video on this topic. I am Dr. Shobhana Mohandas. I am a gynecologist and laparoscopic surgeon at Sun Medical Center, Thrissur, Kerala. Generally, people think it's because of urinary infection. Then they say, I've got urinary infection, please give me some medicine on phone. And what they think as urinary infection is actually itching caused by fungus. Some others, they come and say, I've changed my underclothes, I've got allergy to it, doctor, give me some anti-allergic drugs. But generally, it's neither urinary infection nor allergy. Quite often, more often than not, it is fungal infection. And once they are told that they've got fungal infection, they get very distressed. Doctor, I never had it all this while. It's not that you always have it from the beginning. There can be a first time quite often. Many others will say, Doctor, I've been to so many people and it goes off, it keeps coming again. Yes, it can come again, just like lice in the hair, it can come again. But if you have cold recurrently, you don't get upset. If you get some boil in your foot, you don't get upset. So why do you get upset if there is fungal infection coming again? But there are drugs for it. So why me? I am quite clean, I take bath. It's not like that. Basically, we've got a very humid temperature. There is a lot of humidity in the atmosphere and it is a hot climate in India. Therefore, fungal infection can be common in India. So what can we do about it? It's very simple. You give antifungal ointments. The doctor will choose for you which is good for you. If one doesn't work, the next one will be given. Drugs orally are there, and along with that, if there is vaginal infection which has caused this, that vaginal tablets will also be there. So taking these ointments for 15 days after the illness is over is also important. After the itching has stopped, you have to apply the ointment for another 15 days. Then only you can prevent the recurrence. That is one way out. Then there are many other ways. Of course, the doctors will know about it. Then which are the other ways out? Number one, keep the area dry, not moist. Some people when they are hurry, we may or may not wash the area, but we may put the underclothes just over it and that area remains moist. This fungal infection also can come in the armpits. It can come where the nada of the pajama is dried or where the blouse lower portion is there. Wherever the sweat remains, all those places it can be kept dry, and you can apply antifungal powder to keep it dry. Number two, treat the vaginal infection so that after the area outside is dry, the inside fungus comes out and starts disturbing you again. That should not happen. Number three, change your underclothes. Probably, you just 4 or 5 underclothes. If possible, iron it also. The heat will also destroy the fungus. So you use a undercloth after 5 days only. Don't use it in rotation, and be careful about keeping it one after another. Take care to do that. Or after the whole thing is over, just throw one set and buy another set. That's also good enough. So these ways, the spores or the remaining portions of the hyphae of the fungus, if it is remaining in underclothes, it will not come back to you. It can go through the common bathrooms and other things, but then it is treatable. First of all, you don't have to worry. It is not a sign of some very grave illness. It can be treated. Number three, look whether you've got diabetes. This is the time to check if you've got diabetes, because diabetes can cause fungus. And if already a person is diabetic, is the diabetes controlled? Check the diabetes. Check the sugar levels. This is the time to check upon the sugar levels. Then any other grave illness, like, if you're taking a lot of antibiotics, that also can cause fungal infection. Next point is, you take a lot of vegetables and, curds with bacteria. All this thinking will improve your immunity and will help you fight every disease, just like your fungal disease. It's also an infection. So we have got some 18 million bacteria in our body, which is the soldiers which fight our illnesses. So increase the numbers with bacteria containing food like curds. That will improve your immunity. That is called microbial, microbiome of the body can be improved like that. And those microbiomes feed on vegetables, so increase your vegetable intake. So microbiomes, prebiotics and probiotics will always help you fight the fungal infection. There is nothing to be worried about, and it is treatable, it is curable. And just because it is in an area which cannot be seen, you do not have to get distressed at all. Now, quite often patients come and say, I have been treated for fungal infection, but it's not going and now it's burning. This burning can be either because you scratched during the fungal infection, or it could be because they've got something called herpes simplex infection. That is a viral infection, and giving antivirals properly for 15 days will cure it. And that's again like whenever there is no cure either for fungus or for the virus, what you should not do is doubt the diagnosis. What you must do is go to the doctor. If it is not working, please tell the doctor it's not working. She or he will change the antiviral drug or the antifungal drugs. And there are so many of them. So you can try which one works for you. And once it starts working, apply it, use it for 15 days, and it will go off. So whether there is fungus or whether there is virus, itching can be treated quite easily. And if there is a vaginal infection, it can be treated with pessaries and antibiotics or antitrichomonal drugs or antifungal drugs. So whichever way, itching in the private parts can be treated with simple measures. If not, in older age group, estrogen creams or moisturizing lotions can be applied. So there is a wide variety of treatable medicines. No need to worry about it. Thank you so much.